General anesthetics. General anesthesia refer to drug-induced reversible loss of consciousness and all sensation. The features of general anesthetics are reversible loss of consciousness, reversible loss of sensation, analgesia and dynesia, muscle relaxation, and abolition of reflexes. There is no single anesthetic agent that can produce all the above effect. The anesthetic protocol include pre-medication, induction of anesthesia, maintenance of anesthesia, skeletal muscle relaxation, analgesia as pre-medication during and after the operation, use of other drug to reverse neuromuscular blockage, to reverse the residual effect of opioids and benzodiazepine. Minimum alveolar concentration is the minimum concentration of an anesthetic in alveoli required to produce immobility in response to a painful stimulus in 50% patients. It indicates the potency of inhalational general anesthetics, nitrous oxide more than 100%, halothane 0.75%. Mechanism of action of general anesthetics. The main site of action of anesthetics is reticular formation, which normally maintain a state of consciousness. Most anesthetic depress reticular formation by enhancing the activity of inhibitory transmitter and blocking the activity of excitatory transmitter. Stages of general anesthesia. First, stage of analgesia. The patient is conscious but drowsy. Second, stage of excitement. Patient lost consciousness. Sympathetic activities increase heart rate, increase blood pressure, pupil are dilated, muscle tone is increased, breathing is irregular. Third, stage of surgical anesthesia. Respiration become regular, muscle relax, reflexes are gradually lost, intercostal muscles are paralyzed. Fourth, stage of medullary paralysis. Respiration and the vasomotor center are depressed. Death occur within a few minutes. Classification of general anesthetics. General anesthetics divided into inhalational agent, parenteral agent. Inhalational agent further divided into volatile liquid and a gas. Volatile liquid includes halothane, isoflurane, desflurane, sevoflurane, ether. Gas include nitrous oxide. Parenteral agent further divided into inducing drug, slow-acting drug. Inducing drug include propofol, etomidate, thiopentone, methylacetone. Slow-acting drug include benzodiazepine. They are include diazepam, lorazepam, midazolam. Ketamines, opioids. They are include fentanyl, L-fentanyl, sufentanil, remifentanil. Comparative features of ether, halothane, and the nitrous oxide. Ether, volatile liquid, induction and the recovery are slow because of its high solubility in blood. Irritant, inflammable, and highly explosive. Has wide margin of safety. Potent anesthetics, minimal alveolar concentration 1.9%, excellent analgesia. Halothane, volatile liquid, induction and the recovery are faster than ether, non-irritant, non-inflammable. Margin of safety is not wide. Potent anesthetic, minimal alveolar concentration 0.75%. Nitrous oxide, gaseous general anesthetics, induction and the recovery are rapid because of low blood solubility, non-irritant and non-inflammable. Very wide margin of safety. Poor anesthetics. Minimal alveolar concentration more than 100%. Comparative features of halogenated anesthetics, fluorinated anesthetics. Halothane, volatile liquid, non-inflammable and non-explosive. Induction and the recovery are slow. Minimal alveolar concentration 0.75%. Isoflurane, volatile liquid, non-inflammable and non-explosive. Induction and the recovery are rapid than halothane. Minimal alveolar concentration 1.4%. Desflurane, volatile liquid, non-inflammable and non-explosive. Induction and the recovery are rapid. Minimal alveolar concentration 6%. Sevoflurane, volatile liquid, non-inflammable and non-explosive. Induction and the recovery are rapid. Minimal alveolar concentration 2%. Parenteral general anesthetics. Inducing drug contain propofol. It is available as 1% emulsion for intravenous administration. Propofol is a commonly used, popular, rapidly acting anesthetics. Propofol acts on GABA receptor to increase chloride conduction and hyperpolarization of neurons, thus produce CNS depression. It has a rapid onset and a short duration of action for a long period. It can be given in repeated doses. as continuous intravenous infusion. It is highly bonded to plasma protein, crosses placental barrier and can be used in pregnant women. It is metabolized in liver and excreted rapidly in urine. Induction of anesthesia and recovery are rapid. Residual symptoms are less. Most suitable for outpatient surgical procedure. No irritation of air passages, suitable for use in asthmatics. Has antiemetic effect, hence post-operative nausea and vomiting are rare. Can be used for both induction and the maintenance of anesthesia. It is used in status epilepticus when not controlled by other drug. Cause respiratory depression and a fall in blood pressure. Pain on injection occur can be reduced with lignocaine. Thiopentone sodium. It is ultra short acting barbiturate. It is commonly used intravenous anesthetics for induction of anesthesia. It is highly lipid soluble, hence has rapid onset and short duration, 5 to 8 minutes of action. It is highly alkaline, pH 10.5 to 11. Highly irritant, it should be prepared as a pre-solution before injection. It is injected as 2.5% solution. After a single intravenous dose, it rapidly enters highly perfused organs like brain, liver, and heart and produce anesthesia. As blood level of the drug fall rapidly, it diffuses out of the central nervous system into the blood and then to less perfused organ like skeletal muscle and adipose tissue. This redistribution results in termination of drug action. Repeated dose will result in accumulation and delay recovery. Uses of thiopentone. Thiopentone sodium is used for induction of anesthesia. It is occasionally used as anticonvulsant in case not controlled by other drug. In subanesthetic dose, thiopentone can be used for narcoanalysis in psychiatry. Advantage of thiopentone. Rapid induction of anesthesia and rapid recovery. Does not sensitize the myocardium to circulating catecholamine. Adverse effect of thiopentone. Depress the respiratory center, depress the vasomotor center and the myocardium. Poor analgesics, poor muscle relaxant, causes laryngospasm. Etomidate. It is a intravenous anesthetic used for induction. Has a rapid onset and a short duration of action. It causes minimal cardiovascular and respiratory depression. Adverse effect of etomidate. Has poor analgesic effect. High incidence of pain on injection. Post-operative nausea and vomiting. Restlessness and rigidity are common. Slow-acting drug ketamine. It produces dissociative anesthesia, which is characterized by sedation, amnesia, marked analgesia, unresponsiveness to command, and dissociation from the surrounding. It acts by blocking N-methyl D-aspartate type of glutamate receptor. It is commonly given by intravenous route. Other routes are intramuscular, oral, and rectal. Ketamine has analgesic effect. It causes bronchodilation, suitable for use in asthmatics. Ketamine causes sympathetic stimulation. Heart rate, blood pressure, cardiac output, and skeletal muscle tone are usually increased. It is used in patients with hypovolemic. It is well tolerated by children. Site of action, cortex and the subcortical area. Ketamine is highly lipid soluble, rapidly enter highly perfused organ like brain, liver, heart, etc. Later it redistribute to less perfused organ. It is metabolized in liver, excreted in urine and bile. Uses of ketamine for operation on the head, neck and the face, for dressing burn wound, well suited for children asthmatic undergoing short procedure. Adverse effect and contraindication of ketamine. Increased blood pressure and heart rate is contraindicated in patients with hypertension and ischemic heart disease. Increased intracranial pressure cause emergence, delirium and hallucination. Benzodiazepines. Benzodiazepines are slow-acting parenteral anesthetics. They include diazepam, lorazepam, midazolam. Use of large dose delay recovery and prolonged anesthesia. They have poor analgesic effect. They do not cause post-operative nausea and vomiting. The effect of benzodiazepine can be reversed by flumazenil. They are useful for angiography, endoscopics, fracture reduction, etc. Opioid analgesic. They include fentanyl, L-fentanyl, sufentanil, remifentanil, and the pethidine. They are potent analgesics and can be used along with anesthetics to decrease the requirement of anesthetics. Complication of general anesthetics: hypotension, cardiac arrhythmias, cardiac arrest, respiratory depression, expiration pneumonia, apnea, convulsions, persistent sedation, nausea, vomiting, hepatotoxicity, nephrotoxicity, malignant hyperthermia.